Tennis elbow is an musculoskeletal disease. Look at this picture, shows that elbow joint, tendon, X-ray findings, CT, look at this, and MRI to identify tendon degenerations. A detail going on. Introduction. Tennis elbow or lateral epicondylitis is a painful condition that occurs due to overuse of the elbow joint. It predominantly affects individuals who perform repetitive arm, elbow or wrist movements, leading to inflammation of the tendons that attach to the lateral epicondyle of the humerus. Despite its name, it is not exclusive to tennis players and can occur in anyone engaging in repetitive forearm activities. A definition: tennis elbow is a tendonitis or tendinopathy involving the extensor carpi radialis brevis muscle, characterized by pain and tenderness on the outer part of the elbow. It results from microscopic tears in the tendon caused by repetitive stress or strain. Types: 1. Acute tennis elbow develops suddenly due to a specific injury or repetitive activity. 2. Chronic tennis elbow, long-term condition arising from repeated overuse or untreated acute injuries. Causes: 1. Repetitive stress, overuse of the wrist and arm muscles during activities like tennis, painting, or typing. 2. Improper techniques, incorrect movements in sports or occupational tasks. 3. Trauma, the direct blow to the elbow causing tendon damage. 4. Aging, degenerative changes in the tendons. Risk factors: 1. Occupation, job requiring repetitive wrist and arm motions, example carpenters, painters. 2. Sports, players of rocket sports with improper techniques. 3. Age commonly affects individuals between 30 to 50 years. 4. Poor conditioning, lack of flexibility or strength in forearm muscles. 5. Gender equally affects men and women. Complications: 1. Chronic pain in the elbow. 2. Weak grip strength affecting daily activities. 3. Progression to other tendinopathies. 4. Reduced range of motion in severe cases. 5. Psychological stress due to prolonged disability. Pathophysiology: initial micro trauma, repetitive activities cause micro tears in the EC orbit tendon fibers. Inflammatory response: this leads to localized inflammation and cellular changes. Fibrosis and degenerative changes: in chronic cases, tendons show degeneration without significant inflammatory markers. The underlying process in tennis elbow involves a progression from repetitive microtrauma to chronic tendon changes. Below, in the step-by-step pathophysiology: 1. Overuse and microtrauma. 2. Inflammatory response. 3. Mechanical overload. 4. Tendon degeneration, tendinosis. Over time, the condition progresses to tendinosis, characterized by loss of normal collagen structure. Collagen fibers become deorganized and loss tensile strength. Angiofibroblastic hyperplasia: new blood vessels form, but they are immature and inefficient. Fibroblast proliferation: abnormal fibrous tissue replaces healthy tendon tissue. Lack of inflammatory cells. Chronic cases show minimal or no active inflammation. 5. Weakening of the tendon: the degenerated tendon becomes weaker, less elastic, and prone to further injury. This contributes to chronic pain, reduced range of motion, and loss of grip strength. 6. Neural sensitization: this sequence underscores the transition from an acute inflammatory condition to a chronic degenerative disease, which is why Effective management is essential to prevent long-term complications. Signs and symptoms. 1. Pain and tenderness over the lateral epicondyle. 2. Pain worsens with gripping, lifting or wrist extension. 3. Weak grip strength. 4. Swelling or warmth less common. 5. Difficulty in extending the wrist against resistance. Diagnosis. 1. History and physical examination. Pain localization and activities worsening and symptoms. 2. Provocative tests. Cosen's test. Resistor to wrist extension causes pain. Miller's test. Passive wrist flexion with elbow extension reproduces pain. 3. Imaging studies. 1. X-ray rule out arthritis or fractures. 2. MRI identifies tendon degeneration. 3. Ultrasound visualizing tendon abnormalities. Nursing diagnosis. 1. Acute pain related to tendon inflammation. 2. Impaired physical mobility related to pain and weakness. 3. Risk for activity intolerance due to pain and discomfort. 4. Self-care deficit related to limited elbow function. 5. Anxiety related to prolonged recovery or inability to work. Management. Medical management. 1. Medications. NSAIDs, example ibuprofen, naproxen to reduce pain and inflammation. Corticosteroid infections for severe cases. 2. Physical therapy, stretching and strengthening exercises. Techniques like eccentric strengthening for tendons. 3. Orthotics, brace over the forearm to reduce strain on the tendons. 4. Surgical intervention is rare, indicated for persistent cases. Repair of the affected tendon is performed. Nursing management. 1. Pain management. Administer prescribed medications. Educate about using cold packs to reduce inflammation. 2. Encourage physical therapy. supervise prescribed exercises, promote adherence to therapy schedules. 3. Patient education, importance of rest and activity modification. Ergonomic advice for daily activities. 4. Monitoring assesses for improvement or worsening symptoms. Document range of motion and pain levels. Treatment: 1. Non-surgical rest, ice and NSAIDs. Physiotherapy focusing on strengthening and flexibility. Extracorporeal shock wave therapy ESWT. 2. Surgical reserved for refractory cases after 6 to 12 months of conservative treatment. Psychosocial medicine. 1. Emotional impact. Pain and disability may cause frustration, anxiety or depression. To support, encourage open communication about concerns. Refer to counseling or support groups if needed. 3. Holistic care. Address psychological and social aspect of recovery. Prevention. 1. Use proper techniques during supports or repetitive tasks. 2. Warm up and stretch before engaging in physical activities. 3. Avoid repetitive wrist movements or take frequent breaks. 4. Strengthen forearm muscles to enhance resilience. 5. Use ergonomically designed tools or equipments. In conclusion, tennis elbow is a manageable condition with timely diagnosis and treatment. Adaptive preventive strategies such as proper ergonomic and conditioning can significantly reduce its incidence. Effective medical and nursing interventions not only alleviate pain but also restore functions, allowing individuals to return to their normal activities. Thank you. Have a nice day.